Well, Clomid is a very old drug, and all it is an anti-estrogen. It confuses the estrogen receptors into thinking it's estrogen, but it's not. So it confuses the pituitary gland into thinking there's not estrogen around because it's blocking the impact of estrogen, the inhibitory impact of estrogen on the pituitary. So you make more FSH and more LH. And so that's the way it works. It's a very, very old drug and results in the very best quality eggs. But it's a lower pregnancy rate if you just give it to someone in the absence of IVF. And the reason is because it's an anti-estrogen, it has a negative effect on your uterine lining. And you may not see that negative effect on ultrasound. I mean, often we see a thinned out lining on Clomid, but you may not see a thinned out lining. It may be very subtle, but it's definitely having an inhibitory effect on your embryo implantation in your uterus because your uterus depends on estrogen, and this is an anti-estrogen. That's how it works. So what we like to do if we use Clomid with our Mini-IVF protocol is to freeze the embryos. Thanks to Dr. Kuyama years ago developing vitrification, we can freeze the embryos without any fear that we're going to hurt them, and then transfer them 3 months later after the uterus has completely recovered from the antagonistic effects of Clomid on the uterine lining. So that, and we used to say, well, maybe a week later or a month later or 2 months later, but we found with all of our studies that we're better off waiting 3 months before doing that transfer to let the uterine lining be as perfect as it can be.